What do you think is chemotherapy?
Well, chemotherapy is a medical process by which a person gets an IV with a chemical, and this helps to kill the cancer cells that the person has in his body. It's a process that is only for people who have cancer, and that are like it can be done like on the early stages of cancer or at the at the middle of the process. It's helpful to kill the cancer cells so the person can have a better recovery from this disease.
It's a therapy for the cancer disease.
Chemotherapy is a treatment that it's applied to people who have cancer, and it's based on something like radiation for killing the tumoral cells.
It is a therapy for people with cancer.
Is something about treatment of cancer patients.
What is chemotherapy?
Quimioterapia, como su nombre lo indica, es las drogas que se usan o los medicamentos para tratar el cáncer.
What is the effect of the chemotherapy in the organism and how does it work against cancer?
El cáncer es una enfermedad en donde hay un desarrollo desordenado y rápido de división celular en los diferentes órganos del organismo. Cáncer diagnosticado, cáncer tratado. Hay diferentes clases de drogas para el uso de este tratamiento. Drogas que se deben aplicar periódicamente, los médicos lo denominan ciclos. Por lo general son más de un ciclo, en promedio 3 ciclos. Son drogas que se pueden administrar por vía oral, por vía parenteral, o sea por vía intramuscular o subcutánea, por vía endovenosa a través de catéteres implantables en venas de grueso calibre en el organismo. También se pueden aplicar por vía intratecal, o sea a través de la médula llega uno al espacio raquídeo y allí aplica uno la droga.
In which cases is this treatment applied?
El tratamiento se debe hacer apenas se diagnostique el cáncer, se debe tratar como ya lo dijimos. Estas drogas también producen efectos secundarios como alteraciones de caída del cabello, alteraciones del cuero cabelludo, alteraciones en la piel, alteraciones en las uñas, puede producir alteraciones a nivel de nervios, irritando estos mismos, puede producir alteraciones gastrointestinales, como también puede producir alteraciones de irritación en vejiga y uretra. También son muy propensos a las infecciones, por lo cual hay que tener mucho cuidado en pacientes que están en quimioterapia. También pueden producir alteraciones en la coagulación por lesiones en las plaquetas. También puede producir lisis de los glóbulos rojos, o sea, producir anemia.
Why are the results of the chemotherapy different in each patient?
Desafortunadamente, dependiendo también del tipo de cáncer, la respuesta, porque los pacientes todos son individuos y cada uno pues responde diferente a pesar del tratamiento que se instaura. Desafortunadamente es una pregunta muy difícil de contestar debido a que si supiéramos por qué en algunos no actúa, podríamos saber e indicar nuevos tratamientos.
Would you tell me, please, about your experience with the treatment?
Well, yes. Yes, of course. Actually, I have to say that I have had different kind of treatments. So the first of them would be something similar to surgery. I've been through like 14 times at this point. And then some sort of chemotherapy, which is basically injecting on-site some sort of poison in order to control the cells that are growing in a disorderly way. And then I have gone also through another treatment, which is some sort of, let's call it biotherapy, which is, of corresponding to chemotherapy, but using biological products instead of using chemical products. But the effect and the process is exactly the same. So I've been through these three kinds of treatments, and in different stages and in different moments, and different number of treatments.
And since when are you receiving this
Oh,
kind of
this
treatment?
is a nice story. I've been there for 3.5 years, I guess.
Is there any aversion to the treatment or
Of course there is. Yes, I mean...
some side effects? Or?
Yes, actually I have to say that the kind of treatment that I receive is kind of an easy one, is on the easy side of the chemotherapy treatments. And it is because it is on-site. So I don't get poison all over the body, but I get poison only on-site. And the kind of CA that I have is some sort of restricted to a certain area, actually the bladder. So the chemotherapy that I receive is actually on-site, directly into the bladder. So it makes it a lot easier than when you get this kind of chemotherapy all over your body, because that's tougher. Even though there are, of course, side effects. And the first side effect, I would say, is psychological. I mean, is the experience of going through that. It's pretty invasive, it's pretty boring, it's pretty... it's not a nice experience, I have to say, but then you get used to everything, like we human beings do. And then there is also some sort of side effects. Now, on the biotherapy side, there's a side effect which is some sort of arthritis that I have developed all over the body. So when I'm close to the treatment, I mean when the treatment is accumulating the product inside the body, then I start developing some sort of arthritis. And that is kind of painful, and that is kind of surprising, and that's kind of uncomfortable, I have to say that.
And after treatment, do you feel better?
No,
Even though you have side effects?
No, I don't feel anything. I mean, I feel dizzy, and I feel tired, and I go to sleep. And I usually sleep for, I don't know, 2 or 3 or 4 hours, and then I'm back on. And but the effect comes a couple of weeks afterwards, and depending on how long the treatment is, because I've been through maybe 5 or 6 sessions, calling a session a number of events, like 6 events once a week. So when this is accumulating, maybe for the 3rd or 4th event, then you are kind of sick. You're really in pain. But then for the 6th, you're really dying. And then a couple of weeks afterwards, or maybe a couple of months afterwards, you're starting to recover. That's getting better. But that's not common. I mean, that's 1 in 1,000, as statistics says. Unlike everything that's said in statistics, that's a lie.
Do you feel satisfied with the treatment?
I don't think it's been worth. I mean, I love my doctor, I love the nurses, I love the place, and I have a very nice relationship with them all. I'm usually in a good mood, so that helps me a lot. But I mean, as I have had not been in front of any drastic situation, like one of these huge surgeries taking away half my body and that kind of stuff, then I really don't feel what the improvement is.
Paola Rodriguez studies at Universidad del Rosario. She is in 9th semester and it's gonna explain us treatment in this area.
Basically, what I do at Clinical San Diego is a psychological assessment of these patients who has any type of cancer. I work with children, with young adults and adults, but especially in children whom are in treatment of chemotherapy. We start to evaluate their adjustment areas. For example, we are interested in knowing what about their families, what about the social part, the affective part, the emotional part too, and of course the cognitive part. It's really important to know what they think about the illness. For example, they can think that cancer is punishment, it's a kind of punishment. So in therapy, session by session, we start to give them some strategies to in order to start in them a type of insight about what they think have an impact in what they do and what they are involved in the illness. With this information on the adjustment areas, we start to then evaluate the familiar area, which is the more problematic one because sometimes the beliefs, the values in one family are not compatible with the process of the illness and with some medicine things. So with that information, we start to have the first intervention is crisis, in which we gave them, the patient and the family, a whole solution and a whole comprehension of what the illness is, of what they think is important, on how they develop in the process of the illness, and how they are adapted or not in the process of the whole illness. So the most important thing here is to getting the insight in them and how all that they do, that they think, and all that they do, it has an impact in what the process of the illness is going to be. Yes, so the objective is to change the way they think when it's not adaptive, and give them tools to improve the process of adaptation in the whole process.
Mainly, we have to identify the classes of patients that we are going to deal with. We have different patients. The patients that are just got this diagnosed. So the doctors tell them you have cancer. So we have to make like an intervention with those patients, and also the patients that are already in the treatment. That means in the chemotherapy, in which we have to make like a following therapy with all those patients to help them with all the things that they need. Okay, first I'm going to talk about the crisis intervention with the patients that are just got their diagnosis. So the first thing in a crisis intervention that we have to do is follow 4 main steps. The first step of the crisis intervention is to identify all the emotions that the patient is having right now in that moment. So the help that we have to patient to understand what he's feeling and why he is feeling that. So that is the second step that we have to follow. The third step that we have to do is about looking like forward to the future. So what we have to do is to try to talk with the patient and try to identify what he's expecting from the disease and also from the treatment that he's going to start. So the last step is like identifying and also making the patient to understand his conditions, his actual condition, and help him or help her to make a better understandable and also a better situation to deal with, so they can like feel better about their illness and also the treatment that they're going to start. The other intervention that we make in the hospital is with the patients that are already in chemotherapy. Those patients are already in a treatment, in a medical treatment, and what we have to do is to make like a therapeutic follow among the time, so they can like realize about what they are going through, because in chemotherapy they have to deal with a lot of things that are like the side effects of the pharmaceutical frame. So are like things like the losing of the hair, also the nausea, the vomit, like affecting the patient in that way. So that's all the things that we make in this kind of cases.